Due to the previous commitment, Dr. Hurley cannot stay with us, fortunately. We have the Senior Program Manager from Vitamin Angels, Miss Kin Harvey. Ms. Harvey leads the organization's efforts to advance policy change and effective implementation of MMS programs globally, and she has supported the expansion of the MMS program to over 55 countries, reaching over 2 million pregnant women annually during her time at Vitamin Angels. She also coordinates Vitamin Angels implementation research to support effective programming activities. She will be the one answering your questions on benefits and evidence of MNS, including the global policy guidance and implementation science process. Okay, so at this point, we would like to now open the question and answer forum, and we would like to ask the following. May we call on Dr. Huguan to please be on screen? Uh, Miss uh, Miss Luz Tagunikar. Yes, thank you, mom. And then uh, Miss Harvey. Okay. Uh, okay, Miss Huguan. Okay. Our first question, I think, addressed to Dr. To the DOH primarily, Mom on to Mom Luz. Regarding the since pregnant women are receiving uh, iron folic acid and at the same time the micronutrients in terms of reporting, Ma'am Luz, is there a possibility of double reporting from those who are receiving iron and then for those who are receiving multiple micronutrient supplementation? How do we address this so that to avoid
Okay.
double reporting?
So in some areas where the multiple micronutrient supplement is being provided, we also request NGO partners of Vitamin Angels Alliance to coordinate with the local government units because in areas where there are MMS, we would like to shift the use of IFA to MMS on those areas where it is available, and it can be reported as in the FHSIS as the number of women given complete iron supplementation, as the iron content of MMS is also within the recommendations of the World Health Organization. We said there should be close coordination between the NGO partners and the local government units because MMS is basically recommended for pregnant women, and there's no study yet on its, although it could be possibly effective also in other women of reproductive age, but because of resources also, we would like to focus the use of MMS to pregnant women. So in areas where MMS is there, we are recommending to LGU to use the IFA for lactating women, or to administer or provide the iron and folic acid to women of reproductive age or the adolescents, and also the lactating women, so that there will be no duplication. I think it's not also cost effective that a woman will be getting IFA and MMS at the same time. So we need to shift the use of IFA to other target population of micronutrient supplementation, and these are the adolescents or the women, and the women of reproductive age, and the pregnant, and then the lactating women. And we will give the MMS to pregnant women if this is available and if it is being provided by the NGO partners. And it will be reported as IFA, complete iron supplements given to pregnant women. So it can be reported by the local government unit as an accomplishment in the Field Health Services Information System.
Well, thank you, Ma'am Luz. Okay. The next question is addressed to Miss Queen. Okay. In the countries where Vitamin Angels is supporting MMS introduction, what are the common barriers to MMS uptake and compliance that have been identified through the implementation research?
Yeah, thank you for that question. We've found through doing kind of formative research where we've interviewed, pregnant women, their families, healthcare providers, that a lot of the barriers center around access. So even accessing health facilities where they can receive antenatal care, where they can receive MMS or other prenatal supplementations, access has been a barrier. Also, just kind of knowing about the supplements and why they should be taking them, because even if they do receive prenatal supplementation, oftentimes it can be challenging to remember to take MMS and to take it every day, which will give them the greatest benefit. And then other barriers might exist around perceptions or maybe myths in the community where they might prefer not to take it. So we're trying to address all those barriers as well as take advantage of any enablers that may exist in order to help support increasing uptake and adherence.
Thank you, Ms. Queen. To Dr. Huguan, Mom, you mentioned cost effectiveness. We would like also to know, are there plans for researches how in terms of the compliance and uptake among Filipinos, especially the pregnant women? Uh, are there any plans to do some researches on the uptake and the compliance among Filipino women on the MMS? Or any researches that would really benefit the policies and program policies and formulation of it. Ma'am, yes, ma'am. Any plan of other research agenda in the near future?
Okay, good morning, everyone. Sorry, I have a problem with my camera. Oh, I'm there already. So, okay. So, regarding your question on plan to do research, as Ms. Luz Tagunikar have mentioned, we are DOH with the UNICEF and then NI is planning to do an implementation research. And that is one of the requirements for us to transition from IFA to MMS. Regarding other research, I do not have any idea, but maybe Luz from the OH could provide us further plans if there are. So I'll turn over to Ms. Luz Tabunikar.
Yes, thank you, ma'am. Ma'am Luz, can you?
Yes, based on the National Nutrition Survey, there are a lot of multiple micronutrient supplements that are or micronutrients being taken or being consumed by pregnant women. So in their recent rapid nutrition assessment, there's certain percentage of women that are taking iron and folic acid. Some are just taking folic acid. Some are just taking actually the iron, and some are taking multiple micronutrient supplements. So it's very critical also that the Department of Health would really engage also the society, the OB/GYN society,
Yes.
so that when they prescribe, I had a recent experience where my niece got pregnant and she was prescribed separately folic acid and iron, and I said no. So I requested Vitamin Angels for a complete Unimap multiple micronutrients. So you need not take several tablets or capsules just to complete your micronutrient requirements. So I think the study that will be done by UNICEF with NI and Vitamin Angels would complete the evidences for DOH to really push for the policy using MMS in the country, because the evidences on the cost effectiveness as well as the safety and efficacy has already been done very extensively in other countries. So it's just that the uptake as well as the acceptability and the feasibility will be the one that will be uh, used in the country. And so later on, this will be also used as evidence for policy development. And I think future studies would really depend on whether the government would really implement it. And we can look at other future studies with FNRI, like we used to just get the iron status of women. So probably in the future, we could include other micronutrients so that there could be a local evidence that indeed multiple micronutrient supplements would really improve the nutritional or the micronutrient status of pregnant women in the country. So this will be done in the future if and when the country really adapted the shift from IFA to MMS.
Thank you.
Thank you.
Thank you, Ma'am Luz. Ma'am, this is a follow-through question also. Once the MMS is already included, this raised by Dr. Bansag from ARP. Once the MMS is already included in the Philippine National Drug Formulary and procurement has been done, how can we assure that the commodities will reach the mothers nationwide before its expiration date, especially now that we are in this pandemic?
Okay. So actually, we had a lot of problems in the past because of the pandemic and a lot of factors also that prohibit the Department of Health to really download the commodities on time. So we're now thinking of several avenues really to improve supply chain management. So if this is going to be made available nationwide and it's in the National Drug Formulary, our options could be we download the money to the regional offices. They make the procurement so that they will be nearer the local government units. Or we can procure centrally, but the delivery would be directly to the regions so that they can be easily distributed to the local government units. There's a lot of possibilities, and I think the Department of Health is really making an effort to improve its supply chain management. I think we have strengthened the office. It's now a service from a division, so they have more people. And I think they're procuring now the electronic logistics information system to be able to track and really monitor the delivery of these commodities. The previous years had been really a testing or a very challenging year for us because of the pandemic, the lockdowns, and of course, the priority is always given to commodities used for COVID-19 response. But right now, I think one of the things that is being deployed by the logistics management service is that now for the vaccines, they contracted a separate third-party logistics provider service to focus on vaccine delivery so that it will not be anymore be the concern of the DOH Central Logistics and Procurement Office, so that they will focus more on the routine drugs and commodities that are being procured and to be delivered by Department of Health. We know the system is not perfect, but we are trying very hard to really improve. And we are also getting some technical assistance from UNICEF and World Health Organization to really improve our logistics or our supply chain management. Thank you.
Thank you, Ma'am Luz. Uh, Regarding po the monitoring of this MMS, in this time of the pandemic and then very limited in terms of the coordination process, how do the DOH and the local government, including program partners, can navigate and submit reports to the proper authorities so that there will be a regular release of data? So, Ma'am Luz.
Yes, in the previous year, we are all really been challenged by a lot of these things. So the local government units and the Department of Health are really in constant dialogue on how really we can improve delivery of the routine services as well as the reporting of these services. No, and also the tracking. Really, the field health services information system, as well as the rapid nutrition assessment of FNRI, is showing that there's really a decline in the uptake of services or access or delivery of these services. So we issued a policy really encouraging the people, especially the local government units, not to forget the routine services, which is also critical to be delivered during this time. So the strategies being employed by the Department of Health is really integration of package of services. So if there's an immunization campaign or an outreach, then they have to bring also other services during those times. Like we know that people really go for immunization. So in the last measles immunization campaign, we also integrate giving of vitamin A, micronutrient powder, and other supplements to
Yes.
mothers and children. So we need to re-strategize during this pandemic. And I think one of the key strategies would be integration with other programs, especially if they have outreach activities. Thank you.
Okay, Ma'am, thank you, Ma'am Luz. Uh, Now we have one question to Miss Queen. What are the benefits of giving MMS to pregnant women in their first trimester?
Yeah, that's a great question. So, Dr. Hurley actually mentioned the meta-analysis by Smith et al., and that found that early initiation of MMS in pregnancy, as well as things like high adherence to MMS, provided greater overall benefits to pregnant women. So specifically for initiating in the first 20 weeks of gestation, they found that it provided greater reductions in preterm birth. So, and I'm happy to provide a link to that Lancet article. But for that reason, we really encourage that partners start distributing MMS to women as early as possible
Yes.
in their pregnancies.
Yes, thank you. Thank you, Miss Queen. Uh, for I think this also for the vitamin angels, and uh, I think Dr. Uti can respond on this. What is the present coverage of vitamin angels in the country? Is this increasing despite the pandemic that we are now?
Yes, thank you for that question. No, just as we reported also on day one for the status report of the Vitamin Angels program in the Philippines, we're happy to share that over the past 3 to 4 years that we've started the MMS program here, the coverage of MMS for pregnant women has been increasing over time. So in 2019, we were able to give around 130,000. We were able to give MMS to around 130,000 women. And in 2020, we actually thought that we wouldn't be able to give as much, but we were able to reach around 170,000 women. Of course, relative to the number of pregnant women nationwide, that's still quite small if you take the percentage. But we're happy that the absolute numbers are increasing over time, because we also still have limited supply, and even globally, because it's being spread over all areas that have the need. So we're also happy that the DOH is coming up with will be introducing MMS nationwide on a wider scale.
Okay. Thank you, Ma'am Luz or Dr. Uti. At this point, Ma'am, in terms of the partnership, I think wala po si Dr. Hugwan, but I think Ma'am Luz, you can answer this. How we can increase partnership of the private sectors or the NGOs in the program implementation of the Department of Health under this MMS. Yes, we know that they are now being engaged, but are there any strategies that you can spell it out now so that these partners can really think about it so that they may able to prioritize this in the near future?
Okay. Um, Actually, we are crafting a memorandum of understanding with Vitamin Angels Alliance. So I think we, through this memorandum of agreement, we can engage more with the NGO partners of Vitamin Angels, and we are finalizing it really to formalize our partnership, and so that the necessary logistic support, as well as some policies that need to be in place, should be there to be able to really implement the contents of the agreement. So I think that's critical that we enter into a memorandum of agreement with Vitamin Angels, so that we can work also with the NGO partners of Vitamin Angels. So it's now with me being reviewed,
Wow.
being reviewed before they will really endorse it to the legal service for clearance. But I know we've been reviewing it since last year, so it's almost finished. And so it's very critical that we do the memorandum of agreement so that we can formalize all the engagement as well as partnership, not only at the national level, but of course the NGO partners with the local government units. So we can endorse the NGOs as the NGO members of the Vitamin Angels Alliance to the local government units.
That's really very nice. Now, that's an encouraging information from the Department of Health. I think this question can be answered by Miss Kim and uh, Mom Luz. Okay. Okay. Regarding on the RH, this question was raised by Mom Judy Flores, na RHU Santa Nueva Vizcaya to us. So, uh, honestly, if we're giving faithfully the sulfate plus folic acid, 200 grams over 400 milligrams film coated tablets, vitamins and minerals, is it not harmful if we could still give women's prenatal kit to our pregnant women? Is it not cause or are we not overdosing this to pregnant women? So giving both ferrous sulfate, and then the vitamins and minerals. So I think the question is, are we not overdosing women if we give these vitamins? Okay. Perhaps anyone from Miss Keen or Mom Luz can take this and say your insight on this matter.
Okay, who goes first? Queen.
Yeah, so if I understand the question correctly, just if, just providing MMS alone
A
exceeds
combination.
a
A
combination.
combination. Yes, a
Okay.
combination.
Yeah, no, so there isn't necessarily any risk in providing both. Actually, so like providing them simultaneously doesn't, but I think there are increased risk potentially of side effects, for example, from the high, iron content, which would that, women might not take it every day. So that poses, then it wouldn't have the intended benefit. But yeah, I don't think in terms of providing them at the same time, there's any other kind of risk.
Yes, thank you, Ms. Quinn. Ma'am Luz, can you?
Yeah, as I was saying earlier, it is more cost effective if we just give one, because one multiple micronutrient supplement will suffice to meet the nutritional requirement of the pregnant woman for the day, and giving additional may potentially be harmful, especially if we exceed the allowable requirement for iron, because iron is one of the minerals that has toxicity, and so it's not only practical to give one operationally or because of cost, but also the potential risk it will give to the pregnant woman. So if we're giving IFA, don't give MMS, and if we give MMS, then we don't give the IFA anymore. So actually, if you have both, then you can stretch the coverage actually. So as I was saying earlier, the local government units, the partners of the NGOs providing MMS should also be informed that if they give MMS, they should not give the IFA anymore, and also give it to other target like the lactating women, because some LGUs do not have enough supply of this, or give it to other women of reproductive age and to adolescents that would require only intermittent iron and folic acid supplementation.
Luz, if I may follow up.
Yeah, please.
Because what if for example, a clinic or the facility has the facility to assess the severity of the anemia of the pregnant woman, and they find that the woman has severe anemia? Is it advisable to give, even if they're giving already the MMS, some might be in the practice of also still giving the iron and folic acid?
Yes, but to those with severe anemia, I think the maximum that we can give really is the recommended level is at 60 milligram elemental iron. So IFA has 60 milligram elemental ions, and if you give MMS, then it's another 30 milligram elemental iron. So it would add up to 90 milligrams elemental iron. So it could cause some potential risk also.
But we find also that many partners, especially the LGUs, what they do, they give the MMS to the pregnant women, and then the IFA to the women of reproductive age and lactating, which is a good strategy, right?
Yes, that is the best thing that they can do, to really give MMS to pregnant and give the IFA to other target groups.
Hello, let me add to that.
Yes, ma'am.
Yeah.
Go ahead.
Because in our areas, one province has this Vitamin Angels prenatal micronutrient supplement. So they were asking us if it is okay to give IFA, our IFA, the national IFA supplement, to those who were already given the Vitamin Angels. So we were saying that it should not be, because that is already duplicating the dosage of iron. And then they said that, how about for those who are severely anemic? Because the practice is, for those who are severely anemic, they are giving 2 dosage of our IFA. So that is their practice. So they were asking if it is okay to give
at this point because of the
women.
Yeah.
And then another thing that I would like to emphasize is, it's not only the start that is very important to emphasize to pregnant women. It is completing the 180 dosing, because you will not, the pregnant women will not get the maximum benefit if the 180 is not completed. Thank you very much.
Okay, thank you po, ma'am. Thank you. It's a very nice information. At this point po, we will be entertaining two more questions before we wrap up this. So, from Med Villanueva, are the needs of pregnant person with disability greater than the regular pregnant women? So perhaps Miss Keen and Ma'am Luz can provide insight on this. Are the requirements of those women who are pregnant and with disability higher requirement than those women who do not have any disability when it comes to the MMS? Okay, is it the same or it's not? Okay, uh, anyone? Miss Kin, would you like to start first? Your insight on this matter?
Yeah, so and in terms of disability, what are you referring to?
In terms of the requirement,
Hmm.
yeah, higher than the regular women who do not have any disability at all.
Yeah, I'm actually not. I'm not sure. Maybe Dr. Luce could.
Yeah.
One of the Dr. Luces could answer that.
Okay, thank you. Ma'am Luz, do we have
I think the requirements for pregnant women, whether with disability or not, is just the same.
okay,
Because our Philippine dietary reference intake is done based on the physical makeup of the Filipino women, and I think disability would not, except if they have some metabolic disorders. That's when some of the micronutrients may not be the same as the regular pregnant woman. But if the disability is physical or emotional, then the requirements would be the same.
okay. Dr. Luz, would you like to add more?
Yes, I agree with Ma'am Luz. No, physiologically the needs are the same if the woman is pregnant, but perhaps on in terms of being more at risk because of the lack of access, because they may not be able to go to the facility to access prenatal care or to obtain the MMS. Yeah, in that sense, maybe women who are pregnant and have disabilities may be put further at risk because of the limited access that they would have. The one who asked that, actually, Tita Med, that's their bias because they really have a program for the people with disabilities. And although, I don't think there's a lot of studies yet about, pregnancy in women with disabilities, and maybe there should be, no? But socially and socioeconomically and access wise, they may have some limitations there.
Okay, so we have one more question. I think this could be, well, Mom, in terms of the program implementation from the Department of Health on this MMS, uh, are the other societies like the midwifery or the nursing or society and OBGYN have been coordinating also in terms of one stroke, meaning to say isang kumpas para sa tulong sa programa ng Department of Health. Would you like to comment on this? How we are engaging them together with the private and public partners?
Okay, thank you for that question. Actually, before during the development of guidelines, no, the protocol or guidelines on how to administer or provide even the technical specification, we have a lot of public consultation, and among those that we are consulting are the societies, no, the Philippine Pediatric Society, the OB/GYN, these are the critical societies, and also the Association of Midwives, because they are the ones really basically implementing maternal and child health at the primary care facilities. So before any policy is issued by the Department of Health, it undergoes a lot of public consultation, and almost all, or really all the stakeholders has to be heard about their take on this policy. So yes, we are, and even during the dissemination of the policy, they are part of the group that is being invited to also participate, and particularly in the review of the policies and guidelines to be issued by the Department of Health, because eventually they will be the one to be asked, or even give advice to the local health workers on the policies of the Department of Health. So yes, they are engaged.
So that's also a good news to all our partners who are attending this conference. So talaga you will be involved in the program implementation of MMS. At this point, we'd like to thank on behalf of the Vitamin Angel Philippines, Miss Queen. Thank you for gracing this event, this open forum. Ma'am Luz, ano, sa uulitin po ulit when we have future activities. Of course, to Miss Queen, hopefully that we can future engage you in the future in the activities of the Vitamin Angels Philippines. So maraming salamat po. Thank you very much for making this open forum a wonderful time and enlightening experience to all of us. Thank you, Ma'am Luz, also for joining us this open forum.
Thank you, and it's an honor also to be part of this webinar.
We'd like also to thank Dr. Jocelyn Huguan for giving us also wonderful insight on the cost effectiveness. Ma'am, Doktora, maraming salamat po, and we hope that we can also invite you in our future events.
Well, thank you too for Vitamin Angels. I'm looking forward to working with you and also with DOH on this transition. Thank you and congratulations for this webinar. Thank you.
Maraming salamat po to all. Thank you.